Welcome back. It's time for Morning Rounds. There is considerable overlap between strep throat symptoms and COVID-19 symptoms.
However, there are differences. Joining us over video chat to share what those differences are is pediatrician Dr. Whitney Gutierrez with Christie Clinic. Now, good morning, doctor. Can you start off by telling us what some of those differences are?
Sure. So as you had mentioned, there's a lot of overlap between the two with the coronavirus and then also strep throat. But one of the main differences with the strep throat is that there are not usually other respiratory symptoms such as cough, runny nose, or stuffy nose, whereas we might see that more with coronavirus infection.
And you mentioned, we all mentioned that there's some overlap. So can you talk a little bit about those overlapping symptoms and why people might think that they have one versus the other?
Sure. So fever can be present in both. And so with just a fever, it'd be difficult to really differentiate between the two. Other things, you can have a sore throat with the coronavirus as well. You may have stomach pain, headaches, sometimes even nausea or vomiting. Especially in children, we tend to see a lot of abdominal type symptoms, so stomach pain, headaches actually as well. So in those senses, it's really hard to differentiate between the two.
I actually get strep throat about once a year, actually. I'm kind of prone to it. Is there a specific time during the year when people should be watching out a little bit more for strep throats? I know COVID-19 is a big concern right now, but is there, I guess, a specific time for strep?
Right. Well, we tend to see a lot of it in the fall and the winter when kids are back in school. But I guess we're waiting to see what's going to happen this year, just with all the precautions that we're taking for coronavirus, if that then leads to less strep throat as well. So.
And what should we be doing if we have any symptoms whatsoever of COVID-19 and strep throat? Should we reach out to our doctor, or is it just one of those things, give it some time, let it pass, and then reach out?
Any symptoms at all, I think it'd be a good idea to reach out to your doctor. We are able to do rapid strep testing. We have those results back within minutes. And then coronavirus testing as well. Usually we can get those results back in a few days. Because it is difficult to tell the difference just based on physical examination, and even sometimes with the positive strep testing, your doctor may recommend then even to do coronavirus if you have strep throat.
And doctor, a recent study found that many kids actually who test positive for COVID-19 actually have another virus or bacteria. Can you talk a little bit about that?
Sure. So actually in the most recent article or most recent publication out of pediatrics, they showed that in this study up to 50% of children actually had a co-infection. So that means that 50% of the kids that had the coronavirus, they had tested positive. They also tested positive for a different sort of virus or bacteria. And so that's why if you have strep throat, it doesn't necessarily mean that you don't have the coronavirus, and your doctor may recommend that you should be tested for the other as well.
And doctor, I haven't been tested for COVID-19 yet. I don't have any symptoms whatsoever. Is there anything that's different for patients who might have strep throat where they would need to get tested for that versus a person who might have COVID-19 where they should get tested for that?
Well, if there's not any sort of throat symptoms, no difficulty swallowing, if on physical examination the throat appears normal, and then if there are other respiratory symptoms like cough, runny nose, stuffy nose, things like that, then we may not be thinking about strep, and strep may not be tested for during that visit, and then we may instead recommend testing for the coronavirus.
And while we have been talking about ways to stop the spread, there are some of those things that really can help you stop the spread of strep throat as well.
Right, yeah, I think doing a lot of these things is just going to help in general to prevent the spread of disease. So specifically though, not sharing any sort of utensils like cups or any silverware. If you're coughing into your elbow, keeping that covered, wearing a face mask when socially distancing is not possible. Those are all things that would help prevent the spread of both of these illnesses.
And right now we're talking about a vaccine for COVID-19. I know that's something that's a ways away from us right now, but would you still recommend getting that flu shot?
Oh, definitely. Especially this fall, any extra protection we can get, I highly recommend it. So that should be available come fall, and I think everyone should go get it.
Perfect. Doctor, thanks for your time this morning. We appreciate it.
Yes, thank you for having me.
Have a great Tuesday. Adam has your forecast next. We'll be right back.